Good morning. Good morning. You're welcome to today's lecture, AUM 221, Actions and Uses of Medicines 2. In our last class, we stopped at in our last class we stopped at intra what? Intrathecal. Okay. So today we continue from where we stopped. We'll take a look at intra what? Intra what? Intra what? Intra nervous. Who said it? I heard intra nervous now. Intra inhalational. Ah, Ijoma. Intra what? But you have the material now, right? So we are okay. So okay, we are not done. We are not done with the injection routes. Okay. So we'll take a look at intra. Let's take a look at intraderma. Intraderma. INTRADERMAL. Intraderma. Let's look at intraderma from the name. Huh? You say what? Okay, I said intraderma. Bone marrow inside is spinal cord. No. After us, we are an anatomy lecturer. We are in AUM class. Let's not digress too much. Okay? Intraderma. So someone said it's not in the material I gave you. So put it down. Intraderma. Thank you. God bless you. Okay, from the name intra, inside within, right? Then derma, demis, intra, derma. So here now the drug is given or administered, of course, with the aid of what? The needle is administered within the skin layers. That's the dermis. Within the dermis, use dermis, not just because you have the different skin layers within the dermis. So here the drug is administered within the what? Dermis. Dermis should not be a new term to you. It should not. In your biology, right? Layers of the skin, right? So yeah, I don't think it should be a new term to you. So the drug is administered within the what? Demis. Now this route is mainly used for testing sensitivity of drugs. For testing sensitivity of drugs. Drugs like penicillins. Drugs like what? Penicillin. What is ATS? And what is ATS? What is ATS? What is ATS? With respect to anti-toxins. What is ATS? Please, our medium of communication here is English language, please. I know it's a language, but for now, we still use what? English language. Okay, we have no choice for now, okay? Please. Because you cannot go out in our official thing to present it. Start speaking English. And as you are saying that, see, listen, I'm talking to you, listen. As you are doing that, you think it's our language, but if you want to use Igbo complete from the beginning to the end. And I doubt if you can. So why not focus on English language? True of us. It's true. Atheist is what? What is TT? When someone maybe get injured, I said, have you done? So what is that ATS in that regard? ATS is what? Anti what? ATS. Find out. So it's used to testing the sensitivity of what? Drugs like penicillins and ATS. Penicillins and ATS. Okay, what does it mean? Anti what? Syrup. Serum. Serum. Okay, serum. Okay. Serum. Is this serum? Is it correct for the pronunciation? Serum. Is it serum or serum? Okay. I thought she said serum. Anti what? Please note that too. That's the meaning of ATS. Now let's look at intra-articular that we have in here in between the two A's. Intra-articular. Intra, of course, intra is within, right? Then articular means what? Article. In the synovial cavity. In the synovial what? You know that the junction between, of course, joint is where two bones meet, right? Yeah. That's what we call joint, right? Yes. And now, let's assume these are the two bones, right? They meet in a joint here, and they are covered by muscles, ligaments. Here at the top, at the edge of this, you have the cartilage, the cartilage. Inside this thing is fluid. There's a space here. This space is what is called synovial cavity. And you have the synovial fluid inside this, okay? So that acts as lubrication. You know, with this thing now, the joint can now, you know, here, actually, it serves as a shock absorber within the joint cavity. These two cartilages should not meet as such. they should not meet as such. Even if they touch, and they, as you see in people with arthritis, am I communicating? As you see in people with what arthritis, you see that the cartilage will start wearing out, and the two bones that sliding or friction between because this one may even dry itself in such patients, and this thing will start, they will start doing what? There will friction between them. That's the pain. They start feeling that pain. This whole place is innervated. There's nerves here. They will start feel the pain. The worst of it is that this cartilage will just wear out entirely. That one is the worst. The worst stage. They can't even walk again because the two bones will what, and it's painful. Am I communicating? Now, this intraarticular route is that the drug is injected inside within this synovial cavities, the synovial fluid, okay, for treatment of such patients. Now, so I said, so put it down that this intraarticular route, the drug is injected into the synovial fluid. Of course, you know that the synovial fluid is in the synovial cavity. Okay, you mean this? You will still do this in your anatomy joints, so you still do it. So don't. I just mentioned it to explain for me to be able to explain this articular. Okay. So here the drug is injected into the what? Synovial what? Fluid. So it is useful in treating inflammation in arthritis patients. I think antibiotics and what? Corticosteroids. Antibiotics and what? Corticosteroids. Antibiotics and what? Corticosteroids. So here the injections of antibiotics and corticosteroids are administered in the inflamed joint cavities. I think I've explained this, okay? Inflammation, inflamed joint what? Cavities. So example of corticosteroid there we have what? Hydrocortisone. Hydrocortisone is used in rheumatoid arthritis. Hydrocortisone is an example of corticosteroid. So it's used in rheumatoid arthritis. It's used in rheumatoid arthritis. Is there anything like rheumatism? Are you sure? No. Rheumatism.
There's nothing like rheumatism.
Is that what?
Rheumatoid.
Is there like rheumatism? Can someone confirm for us? Google rheumatism, let's see what is there. Can someone check for us? So, Google rheumatism. Let's see what it means. I'm not saying it does not exist, though. Let's see if it actually exists. Okay, so we talked about intradermal route, intraarticular. So the next one I want us to talk about is intraarterial. Intraarterial. Intra within, arteria, artery. You know, we have intravenous, the vein, right? You have intraarterial. Did you see anything? Yes. What's rheumatism? Common name. Common name what? Leading to musculoskeletal disorders.
that affects one or more structures, such as ligaments, tendons, muscles, and bone.
Rheumatism, right?
Yes. Yes.
What do you see? You.
Or rheumatic disorder are conditions causing.
Wait. I mean, sorry. Did you Google rheumatism? Uh-huh.
A condition causing chronic pain affecting the joint or connective tissues.
Okay. Okay. Just generally, they just classify everything under what? Rheumatism. Okay. Now, from the material, here now the drugs is where? Introduced to where? Into the what? Into the what? Artery. Into what? Artery. Do you know where they use this one mainly? This one is used mainly in cancer chemotherapy. Cancer what? Chemotherapy. Do you know why? Because the thing is, this one, the drug, they introduce the drug to the blood supply directly to the cells, okay? To the cell, so that those cancer cells will be what, taken care of. Venous blood leaves the cell. Hope you know. Are you aware? But the arterial blood goes directly supply the cell. So the drug that will take care of that cancerous cell will be injected in to go to the what cell itself to do what, take care of the what, destroy the what, cancerous what cell. So this is mainly used in there are other situations where you can use them, but mainly in what? It's used in what? Cancer what? You see do cancer chemotherapy. I think that should be in your final year. Next year itself, if you say for final year, it will look as if it's far. It's not far. Okay, so that's the enough we can take on injection route. Okay, because of what I said, that inhalational and the intranasal, right? They are more what? Local than so. We will treat them under what? Local. Am I communicating? So now let's move over to what? Local what? Local routes. So there we look at inhalational, we look at intranasal, even transdermal. Yes, transdermal. Are we together? Are we together? Yes. So that's what I wanted. So let's just go straight to what? Local routes. Local what? Routes. Even transdermal. Transdermal also have a bit of systemic what? Effect. We'll teach all this under what? Local route. So now let's look at local route of drug administration. Let's look at local route of what? Drug administration. So the first one I want us to look at is, what are the routes we mentioned under this local route? What are they? Again? Okay. So let's look at inhalational. Okay. Let's look at inhalational. Let's look at. Remember in your first year, we discussed aerosols, right? Remember we discussed aerosols, and inhalation has two edges. We have the one that is directly gas. We have the one that is appearing in form of aerosols, where you have solid or liquid dispersed in a gas. Okay, that if you apply it, you think that is gas, but it's actually, you know. I think we discussed it in in depth. Okay, where we say that if you now spray it on this thing, you notice that the solid liquid or solid will be deposited on the what? Surface. True of us. Remember that. The same thing in the In you know that inhalers used by asthmatic patients. Remember that one? What is there inside is not actually gas. Is it gas? It's not gas. It's aerosol. It's not gas. Is it gas? It's not gas. It's not gas. What is inside that inhaler is not gas. Remember, I said that inhalation can be has to we have the one that is purely gas. We use that one in anesthetics. That one is purely gas. Then we have the one that is in form of aerosol. So the common inhalers you see is not actually what gas. Maybe in asthmatic patients. Now let's now take it explain. Now, but the one thing with inhalation is rapid. If the inhalation provides rapid delivery of what drug across the what large surface area of what the target is the respiratory what tract and the pulmonary epithelium. Respiratory tract and the pulmonary what epithelium. The lungs. That is the that the surface area. Importance of surface area in diffusion. Remember, right? Good. Now, when the alveoli, the surface area of the nature of the surface area of the alveoli permits it to for this exchange to do what take place there rapidly. Am I communicating? And also it also highly vascularized. True of us, yes, because it's true that the oxygen, the oxygen that comes in, that enters, pass through that capillaries, is taken up to the where, to the heart. True of us, to the blood. Now the carbon dioxide that comes out is also through that capillary that it will diffuses into the alveoli and comes out as the air you do breathe out. Am I communicating? So that place, the surface area that aids such diffusion to take place, and at the same time it is highly vascularized. So as we say, that inhalation provides rapid delivery of drug across the surface area of the mucous membrane of the respiratory tract and the pulmonary epithelium. Now, the effect is almost as fast or rapid as IV. The effect is almost as rapid as IV. But you know that IV is purely systemic. True of us. Yeah, but this one has a systemic and local effects altogether. So I have mentioned before now about gases and aerosol. This route is used for drugs that are gases. Example, those used in anesthetics. I think I mentioned it. It can also be used as aerosol, where you have the solid or liquid dispersed in gas. That is aerosol. So it can also be used. The drug can also be dispersed in an aerosol. Whichever way, this route is very effective and convenient for patients with respiratory tract infection issues, from asthma to COPD. COPD is chronic obstructive. Patient with asthma and chronic obstructive pulmonary diseases. Chronic obstructive pulmonary disease, and those patients with asthma, they benefit. Patient with asthma and the chronic. I think we do asthma in your second semester, AM 222. When we get there, we'll explain more on this asthma. But just take it at this level that they benefit from a patient with COPD and asthma benefit from this route of drug administration. Listen carefully. Do you know why we say that such patient benefit from this? Because this route This route deliver this drug directly to the what? Site of what? Action. And to a greater extent, systemic side effect is minimized. He not say it's removed. He says what? It's minimized. So the systemic effect is not that much, but it's more of what? Local what? Effect. You know that this, if something goes through this, any place the drug is going with its side effect. Hope you know. Hope you know. The more you increase the dose of a drug, the more you increase its what? Side effect. So it minimizes the side effect is at least is reduced to the minimum. It reduced to minimum, because this one in this case now is delivered directly to the site of what? Action. Is delivered directly to the what? Site of what? Action. You know, you have salbutamol as tablet, right?
Yes.
We have it as what? Syrup. We have it as what? Inhaler. Now, when it's taken as syrup and tablet, and when it's administered as inhaler, which one have reduced systemic effects, side effect? Right? I'm not saying that, of course, people see the tablet is still being what? Prescribed. Two of us, they hold it. Those patients, they have the popular brand. I think that should be the innovative brand. Is what? I think that should be the innovative brand. Is what? Salbutamol is what? Brand name. Ventolin now. It's not Ventolin. It's Ventolin. It's salbutamol.
So, sir, is it that albuterol?
We are talking about salbutamol. You are calling it another drug altogether. You are calling it albuterol. I'm talking about salbutamol. Okay? Are we there? Mm-hmm. So the commonest brand name is what? They should be the innovator brand also. Ventolin, salbutamol. Now, so the inhalation, the one inhaled, has reduced what? Minimum side what? Effect. Please note this point. Note this point. Remember, in pharmaceutics, science of dosage form what? Designs. These are things it puts into consideration for designing a dosage form to pass through different routes. We are talking about the same drug now, but one is through the mouth, one is through the ear. But it's the same what? Drug, depending on how it is what? And also how it is the medicine, the dosage form in which it is what? Maybe call it manufactured. It's okay. It's okay. So some people are doing their face as if they are confused. What's the issue? See, I want to correct an impression. Everything concerning pharmacology, this is too small to contain everything about what? What this thing here is just a direction. I gave you this for a direction, for to have a direction. If you allow me, I'll stand here and start talking about here. You become even more confused. It's what? Directional. Am I communicating? So down here, I mentioned a route or a drawer that is not here. Don't squeeze your face. So it's not in the hand. No. Am I communicating? It's just for, and I don't even encourage you to limit yourself to this. It's just to give you sense of what? Direction. Like now, you have with this, now that you capture this in here now, you can on your own learn more on this what? Inhalation. Two of us. Nothing prevents you. You are here to, you don't know where you see yourself tomorrow. This is a real life. This is life you are saving. It must not be the drug here that you would dispense tomorrow. Two of us. This is just to provide a foundation for you to rest and now explore. Two of us. Explore. If I just come in here without giving you anything, I come and talk, you'll be confused. But with this now, if you want to study now, if you want to research more on this, you know exactly where you're going to. Okay, sir. Okay, he mentioned, okay, because of transdermal, which is okay. He also mentioned intradermal. Okay, let me even see what I can pick up from this intradermal. That's how to study. So why I say this is because I have noticed that once I mention something that's not here, faces of some people will change. Maybe they have been reading through what is there the way I've been saying it. I must not follow it like this. Okay. All right. So Madam Abu Abutaro, let's call Yabutaro now. Who said that? Say that. Say what? Was that what we are saying before? Let me see that thing. Let me see what you fast. I think it's not a brand name. Okay. It's not a brand name. It's also a generic name too. Okay. Now, apart from this, the salbutamol I mentioned, we also have I mentioned corticosteroid. Okay, no, corticosteroids can also be administered through this means. Corticosteroid can also be administered through this means. We have through pronounce this through what? Fluticasone is an example of what? Corticosteroid that can be administered through this as inhalation. In this asthma COPD, there's this inflammation of the airways. There's inflammation of the airways. You know that the airways is just when I say airways, hope you know what I mean. So airways is a pipe, right? So this inflammation of the mucous membrane, okay, will give rise to little space in between the what. So the air will fighting for space to pass through. Am I communicating? Am I communicating? Yes. So you know that you know that corticosteroid, they have anti-inflammatory what effects. Theirs is to tackle the what inflammation. Am I communicating? But don't worry, we'll discuss that in detail in your second semester. All right, so these are some examples of drugs that can be administered through what inhalation. Now, as I said before now, as I said before now, it provides what? It provides what? Rapid what? Delivery of what? Drug. So what are the advantages? It can also be an advantage. Rapid what? Absorption. Because of the what? Large surface area of the what? Of the pulmonary, the respiratory tract, and the respiratory tract and the pulmonary what? Epithelium. Large surface what? There's rapid absorption because of the large surface area of the site now. The site, of course, when I say the site, you know what I mean, right? When I say the site of absorption, you know what I mean, right? I've explained that the alveoli and other things. The surface area there is what? Large, okay? Large surface area. So there's rapid what? Absorption. Then another advantage is that it provides. I've mentioned this, but I just want. I'm not giving it to you as what summary, so that you, as key points. I explained it when I explained the inhalational route. Now it provides advantage that it provides what? Local action with minor systemic what? Effects. It gets to the target site of action easily, without entering from one portal, from the stomach portal, come back to systemic effect again. They come back to the systemic circulation, and it goes with side effects. But this one is just target the what? The site of what? Action, and do it so with minimum or minor what? Systemic what? Effect. And it's what? Yes, you can easily, true of us, most patients they do it themselves, except those that except those that go to hospital, maybe for nebulization. There's one they use in the hospital, they call nebulizers. Yeah? Have you seen it before? Except those that use nebules, that one you go to the hospital, nebulizers. But apart from that, the one you just inhale, they use it. In fact, as one patient, they carry it along on their own. Each time they start feeling uneasy, maybe they enter a particular environment where maybe dust or something that will trigger the crisis or whatever, they will do what? Use it. Okay, so is it? I don't think we have any. Do you have any asthmatic here? Do we? Nobody. Disadvantages. Here, just only few drugs can be used. Only few drugs can be used. Not every drug can be used as what? Can be used as what? Inhalation, okay? Okay. So dosage forms, I think I've mentioned aerosols, nebulizer. I think I mentioned nebulizer here. I mentioned nebulizer now. I mentioned it now, nebulizer. I said that when I was discussing the self-administration, I said except those that will go to the hospital for nebulization, right? I mentioned it now. What woman be said that I don't mention it. Nebulizer. If it is spelling you don't know, tell me, I'll write spelling for you. Hey, you say it now. You say sir, spelling, I'll help you. Not I would not. Not that I did not mention it. Okay, you want to see it? See it. Nebu as in Nebuchadnezzar. Nebulizer. Negodu. My God. Please, if you know you will not come on time, give the marker to somebody to bring, please. Because this class start by 7:30, please. Niyonku. You are the class marker and you are coming by this time. Does it make sense? So let's look at the next local routes. I said what I was explaining the fact that in hydrogenal routes, those dosage forms, you can actually self-administer them, except when the patient needs nebulizer. The patient go to the hospital. It's the same drug that they are using, but this one, they do not do it in the what? Hospital. Nebulizer. Am I communicating? That's the point I made there. The same salbutamol appear as nebus. It's not Nebuchadnezzar. Okay. So they use it in the nebulizer for nebulization. Okay. That one now is a machine. It's not like you take it and be going anywhere you want to go. It's there in the hospital. You go, but the one that is handy, you take it in here when the need arises. Okay. Because you know that when the patient is in such crisis, and you can start taking the tablet will break down, and the dissolution will take place, and it will be absorbed, and it will enter portal circulation, and it will go to systemic circulation. The patient would have gone now, but once the patient use it within seconds, rapid action, the person will be regaining. The patient, I don't know if you have seen anybody in such situation before. The person will be okay within. But if it is a tablet you take, then you wait before it will even disintegrate. The patient will go. So I'm trying to point out the fact that it has rapid what? Absorption and onset of action. Okay, let's continue. Remember what I told you about that once the drug finds itself into the systemic circulation, the action starts. It doesn't waste time. But what matters is this, or the site of action. The site of action or the circulation, the effect starts. But how you now adjust to work to try how you now help out to be able to make the action to start immediately is dependent on how you design your dosage form, and how you manipulate, how you make use of the part of the body you want to deliver the drug to, by designing your dosage form so that the drug can easily be delivered. So in such situation, you don't need tablet will not help such patients, except the patient is not having any crisis, nothing, you just want to use tablet, normal, nothing is happening. It's okay. But the one in that particular condition is not tablets. That will help too. And also, you know that if you give it, Even if they say, I have not seen injection, sha, but if you give you injection, you know that you know that your target site is what? The pulmonary what? Epithelium and the lungs and the tract, depending on what you want to treat. Now, before the injection will go on, before the intravenous, if there's anything like that, we'll go and start getting there. What you inhale is entering the what? The pulmonary system immediately. Two of us. Yes. So that's a very important advantage of this rapid absorption and quick onset of what? Action. All right, so now let's look at the next one, the next local route. Let's look at the next local routes. I want to start with the one that have both systemic and the. So let's look at transdermal. Let's look at what? Transdermal. Transdermal. Have you heard of transdermal patches? Have you heard of transdermal patches? Say it. Like plaster, right? Have you seen people with something like plaster on their skin, maybe on their nose? Have you seen people like that? Okay, you see, I have not seen. You said Anyi. Okay, I thought you said Anyi I have not seen. Who has seen it before? Who has seen before? Whether it's movie or whether you seen who has seen it before? Ndị ati Ogechi. What's that? Is that a plaster? Or not plaster? Do you think it's for fashion? I don't know, but I'm not trying to use what you've seen to just. I'm trying to see what I can use to make you understand what I'm saying. I don't know. But whether that thing contains drug, I don't know. But I'm trying to point out how it looks like. Okay? I know you. I know this generation is internet, social media. So if you want to explain things, you use what they see, what they know, what they are good at. That is your. Someone said that she doesn't know that I listen to such songs. Child. Okay, now let's continue. Now, so let's now go to transdermal, okay? Good. Now, okay, now someone asked me some time ago, can what you apply on your skin get to your bloodstream? I said yes. The person was shocked. Please be careful of the cream you apply, please. It enters your system. If drug in transdermal patch, hello, are you aware that your skin has pores? Are you aware? Number one. Are you aware that down we have who? If you see the structure of the skin, you realize that we have blood vessels around the follicular area. Three of us, follicle, there's blood vessels there. The capillaries there. Once they enter, they will always, but it's not as when you now take something or when you inject, but whether it gets to your systemic circulation, it does. Most of be careful about the cream you apply. Some of you damage your livers, internal organs without knowing because of the creams you apply. You're asking yourself, where did this one come from? I don't take alcohol now. So how come? How come? The chief culprit in this thing is hydroquinone. Are you aware? Are you aware? So, ladies, be careful. Be careful of what the cream you apply. I'm not saying it's not good. It's good to apply cream. Wonderful thing. But be careful of the cream you apply. The only time I apply cream is during Hamatan. I just buy Vaseline on my skin. Because if I don't do it, I'll turn to white. That's all. Once Hamatan ends, that's the end. You say no cream again on my body. Huh? Is that what? Ask. Like no. Cream for real. For real. I don't. And even the Hamatan, even during the Hamatan, do you know where I apply the jelly? My face, my lips, and here. That's all. I'm going my way. So please be careful of what you know. Hey, if you know this one, it will make you now buy not just for one cream and that cream. You want to look beautiful. It's okay to look good, but be careful. Don't injure yourself. So now, through the same means, these drugs in this patch enters the what? Bloodstream. So it has systemic effects too. Are we together? Are we together? It also have what? Systemic what? Effects. Now, so this route achieves systemic effect by what? By what? By application of the drug to the skin through the transdermal patch. Sometimes people just call it patches. You see patches, whether it's just ordinary patches, it's talking about the same thing. Patches, whether it's just patches, you see, it's talking about the same thing. Now, but one thing there is that this, unlike inhalational, the rate of absorption may vary. Rate of absorption vary. Am I communicating? Rate of absorption through this transdermal route varies. It depends on the characteristic of the skin where it is what? Applied. Ibulu de your skin. What do you think will happen? Do you think it will easily, the rate of absorption will be the same thing with someone that just bathed and without applying anything? Do you think so? And also, any question? Ask. Okay. So I say that the rate of absorption vary depending on the physical characteristics of the skin at the site of the what? Application. If there is any issue around that skin area where it's applied, it will not get into the what? Systemic what? Circulation. Even if it gets, the absorption will change because of the nature of the skin. The nature of the skin, the physical characteristics of the skin where you apply it. You know, there is no other way you can enter through the skin. Where you put that patch, nature, what is going on around that skin will affect the what? Absorption. That's the point. Am I communicating? It will absorb, but there's no other way you can. It that place you place it is through that skin, that layer, that's where it will pass. If there's any issue there, anything that will block it or whatever, it will not do what? The absorption will do what? It will slow, or it won't even get into the system at all. Now, this is also a wonderful way to deliver sustained release drugs. Yes. That's why they put it and they carry it along anywhere they go. So you think some may think is their own steeds, right? You're not serious. And now some think it is what their own what? You know that the person is undergoing treatment. You wouldn't even know. Some may even go and get anything plaster like that and too. Yeah, I saw one celebrity. Hey, let me put my own without even knowing what is going on. Am I communicating? So now, having put it there, you leave it there. Over a long period of time, the drug will be what? Train and dead. Exerting its effect over a long period. So it's used for what? To deliver for sustained delivery of what? Drugs. Example of such drugs, you have drugs like anti-angina drugs. Anti-anginal. Anginal. It's not natural. Anti-angina what? Drug. Like I think we mentioned nitro what? Glycerin here. For angina, right? Nitroglycerin that you give to us sublingually. Remember, it can also be through patch. Yes. What another name for nitroglycerin? Thank you. So it's also used to deliver birth control pill. Birth control pill. Birth control. Birth control. Birth control pill. There are also the one for maybe musculoskeletal issues, maybe that you can also apply as a patch on the skin, maybe for pain or maybe. Have you seen that those people that are into sports? How I wish you can see something now. Okay. I don't have any picture to show you. I want someone to Google. Let's see if you can see anything like that. Google transdermal patch for pain image. In bracket, put bracket, put image. Transdermal patch for pain. In bracket, put image so that the image will be shown too. If there's anything like that. Did you see it? Bring it for pain, right? Let me see. Others can Google. Let's see. Can you see? Okay, see it here. Let me see if I can. For pain, this one is viral patch for pain. You see it now? Can you see it? Okay, God bless you. You go far. Data-less human beings. Data. That about TikTok. That go. So pain relief paradermal patch. Can you see? Okay, just you see it is there. There are many of them. This one is viral patch. Now this pain, do you think this pain is systemic effect or local effect? It's local, right? Yes. Is it systemic or local? In terms of anti-angina, nitroglycerin, is it systemic or local? Systemic because your heart is not here. Yes. Even if you place it in your chest, if you can something like that here, it will go through the what? Systemic. So it has both systemic. I'm trying to make a point here that it has both what systemic and what local what effect. All right. So the birth control pill is the birth control stuff. Is it systemic or local? Systemic. Where everything happens in your what? Okay. So now this some drugs that can be administered through oral route are better administered through transdermal patch for the following reasons. Some drugs that can be administered, some drugs that I didn't say all, I said some drugs that are administered through oral route can be better administered through what? Transdermal patch because of the following reasons. Number one is to improve patient compliance. To improve what? Patient compliance. Because yes, so there are some patients that maybe it may be a pain relief drug or an analgesic, as case may be. Maybe it may be a drug that you need to take over a long period of time, but due to carelessness or due to not it may not be intentional that the patient may not comply. I think I explained compliance in your first year, right? I explained compliance in your first year. Yes. Is maybe it may be reason that beyond the person's what control that the person misses what some doses of the what drug. To avoid all those, I forgot it. When I was rushing out in the morning to work, I forgot it. I was rushing to lecture, or I wanted to take permission from my lecturer to go and take my drug. He didn't allow me to go out. You know all those long stories. It can be administered as what? Patch. Place it and go your way. Just place it back and you do what? Go your way. The drug release sustained. It can be one can even take you for up to 124 hours or more. You put it there. The thing is entering your what? Systemic what? Circulation. Am I communicating? May compliance maybe that the patient doesn't like anything that has to do with swallowing and anything. So such patients, you place it and the patient, in fact, if it's possible self to even do all the drugs like that self, it's even better self. You put it, but it depends on the physical characteristics of the skin around which the absorption may differ, and you may at the end they may not get exactly what you want depending on absorption. So it's always better to you know that you're taking it, you have swallowed it. But in such a way that the patient will not comply, the person to do what? Do it as what? Patch. Now, another reason is that I think I mentioned this now. Patient having difficulty in what? Swallowing what? Tablet and what? Capsule. Patients having difficulty in what? Swallowing tablet and what? Capsule. This goes beyond, listen carefully, this one I mentioned now goes beyond having issue with swallowing alone. It goes beyond just having issues with what? Swallowing. Remember in your first year, I'll be calling first year because I laid foundation for a lot of things when I was teaching you. That's why I keep referring. That's why I keep referring you to first year. Because I laid foundation to what I'm saying now, that time. Remember in your first year, we did modified release. Good. That modified release is the process of formulation is not just conventional, ordinary tableting. There are other things incorporated in that tablet that make it to modify the release what pattern. So because the patient may not be able to swallow, the person maybe the tablet is intended to have a sustained release or prolonged. The patient will now go and crush that tablet. If you crush the tablet by yourself, it may lose that modified release incorporated in it, and that intention for a certain release may not be what achieved. If you crush it anyhow, pour water and drink it, it may not. So to avoid such, a patient that cannot swallow, and you know that this thing you need to be delivered over a long period of time, the best thing is to go for what? Patch. Because the person may be out of fear of having issues swallowing, may crush it now. You don't take it now. Where they will break it, they will crush it. You will lose what was incorporated in it, and you will not be able to achieve your purpose again. So that's the point I'm trying to do to make here. Now, the third point, the reason why it's preferred is that that we've mentioned that some of the drugs irritate the GI mucosa, right? So if the drug irritate the GI mucosa and this drug need to be delivered, the best thing is to go for patch. The best is to do go for patch. Then another one is that I mentioned almost what I mentioned before. For drugs that have first pass effects in the liver. Remember I told you that anything that enters the mouth must find its way to the liver through portal circulation. From the liver, it will not go back to the systemic circulation before it will start performing its action. So by the time it passes through all those things, the greater percentage of the drug would have degraded, and the effect, the bioavailability will be small. Now, to avoid such drug can be administered as a patch. Another point is that there's what is called drug spike concentration. Once you take a drug, once you take a drug is absorbed, there's what is called this spike. The concentration in the system will do what? We do what? Increase very high and come down, it keep fluctuating. Am I communicating? To avoid such fluctuation that accompany oral routes when drug is absorbed, it's better use as patch. Because that fluctuation, you may not maintain a steady concentration like that in some drug that needs to be maintained. Am I communicating? When a drug is taken orally absorbed, there is this initial concentration will be. When we mean concentration, we concentration in the blood. That's what we mean by the concentration. In your MC, okay, it's in your second semester. It's in 2-1 you do it. When you are taught bioavailability, what were you taught about bioavailability? It's not when you take the drug, the medicine, it will break down. The drug itself will absorb. It will appear in the systemic circulation now. That circulation, that concentration, what to measure is concentration in the blood. There's this spike. Initial concentration will be very high. Spike. We call it drug spike concentration. Experienced during what? Oral. And this thing, you start seeing the concentration fluctuating. You know, there are some drugs you don't need such fluctuations. Am I calculating? Such is better taken used as what? Delivered as what? Transdermal what? Patch. Even there are some drugs that just common drug you take whatever is going on. All you know is that at the end it will take care of what you administered it for. But there are some drugs you should be mindful of what happens when it appears in the what system. By the time you go over to you do your by the time you do your MCB now, apply MCB now, you come across what is called MIC. MIC is minimum inhibitory concentration. Minimum inhibitory concentration. Now, minimum inhibitory concentration. You know, when it comes to some drugs, this is just by the side. I want to use it to explain something. When it comes to the drug that takes care of maybe these antibiotics that fights anti-infectives generally that fights these pathogens, okay, be it bacteria, be it fungi, or what have you. Now, there's concentration, there's minimum concentration that should be maintained in the bloodstream to be able to do what? Attack these organisms. Am I complicated? So that concentration need to be what? Maintained. Now you see that within in the bloodstream there's level. What happens when the drug that enters the bloodstream is a very important issue for you, because you need to understand what happens when a drug has entered the system, because this drug should not give any room for anything that has to do with what resistance or not exerting its what effect. But as some drug you just take paracetamol, yes, but what happens is not really a very serious what issue. I'm not saying that it's not an issue if he doesn't do his work, but it's not what you need to have close monitoring. Hey, monitor it to be sure that this happened. You know that come what may, it will take care of what you take it. But if this one doesn't work, it's problem, because there will be what resistance. Am I communicating? In short, there are some drugs that don't require such fluctuations. It needs to maintain a steady as they enter the system to take care of what is effect. That's the point I'm making here. So, controlled delivery of drug to the skin can provide less fluctuation in circulating levels of what drug, and reduce the drug spike concentration observed after orally delivered drugs. All these things I'm trying to explain is what I just read now. Now, there's one thing with this. One thing I like about this is that, another thing I like about this is that there's flexibility of what dosage. There's flexibility of dosage when it comes to what transdermal patches. There's flexibility of what dosage. Maybe as the drug is there, as the patch is there, anytime you want, you can terminate it. You can terminate the what? Those two of us. Once you remove it, that's the end. Two of us. Depending on the reason, you may have your reason for what? Removing it. It may be because of effects, side effects. Am I communicating? Unlike intravenous, where you don't know what to do, or oral, where you start passing through the stress of inducing MSCs or taking activated what charcoal. Two of us. But this one, all you do is just to do what? Remove it. Simple. Am I communicating? You can easily do what? Remove it. Simple. And go your way. So that was it. Depending on the reason why you want to do what, terminate it. It can be of different what reasons. What's time?
903.
Okay, so I think that's enough we can take on transdermal. That's all we can take on transdermal. So let's go over to the next one. Let's go over to the next one. Let's go over to the next one. Let's look at intranasal. From the name intranasal, nasal means where? Intra, within, right? So in this route, the drug is administered directly into the what? The nose. The drug is administered directly into the what? The nose. We have some drugs like we have the one you are the common one, you are nasal decongestant, right? Nasal decongestant. You are nasal decongestant. We have the one that have the anti-inflammatory. We have the under nasal decongestants. We have the anti-inflammatory corticosteroid, mometasone furoate. Is this not in your material? It is. You say what? What is she saying? That she not see what? Don't worry, I'll come and give you your own separately. Better ask your classmates where they got the material. If those that have it, how did they get it? How did you get your own? From where? Who is Ada? Ada, where did you get your own from? She never get your own from. From where? Okay, where did you get your own from? So where did you get your own from? Group. Which group? So she's the only person in that group. Did what? Huh? It's okay. You said what? Sorry. WhatsApp doesn't misbehave. Hello? Listen. Get listen. If you start playing around, meander with WhatsApp, if you don't understand what you are doing, then that's going to happen. WhatsApp had ever locked me out. Am I committing? Once you start, these things are automated. If you start carrying out some activities they don't understand, they will do what? Simple. It's as simple as that. So the fact, I know what I'm saying. So it's not. WhatsApp doesn't lock people out. Once they don't understand what you are doing again, once you start carrying some activity that doesn't make sense to them, they lock you off for security purposes. These things are for security works until they understand what you are doing. So if every time WhatsApp lock you, your ways are not you. Find out what you are doing. All the time, there are people here. All the time, WhatsApp is doing this to them. It's not true. There's something you are doing. You see alone that knows what you are doing with a WhatsApp line. So let's be sincere with that, please. Let's continue. So anybody that doesn't have this thing should blame him or her what? self, because those that got it from the group. So why are you not in the group? There are people here all the time, almost every month. Sir, I was blocked. Sir, I knew WhatsApp. Sir, all the time, every month. So let's continue, please. So we look at what is it called? Intranasal. So this thing, I mentioned a drug that you shouted. You see in your material. Mometasone what? Furoate. Mometasone furoate. Mometasone furoate. Mometasone furoate. Apart from that, desmopressin is also administered intranasally to take care of what? Diabetes insipidus. See, don't take me becoming now, please. That's a wrong remark. You have this in your material, please. Please, that's a very wrong remark. Are we together? I'm not saying something out for what. So if you have not gone through this now, if you don't have material now, you're already started having issues already. Let me be sincere with you. If you have not gone through material by now, your issue has started. Your confusion has started already. So know that and be happy. Do the needful. If you have not gone through this thing, and make note from it by now. I don't know what you are doing. So by now you should have gone through that, and in the process of making note from it, Google some things you don't understand, some terms that is not clear. By now, your note should be in front of you. You are looking at it, trying to marry what you have read and what I'm saying. Not telling me it's a spelling at this point. Hey, okay. I'll continue.
Like some people that take drugs, the drugs that they use to fight the symptoms of drugs, is it taken by
Symptoms of drug. What are you saying?
So they use it as a basic symptoms of drug abuse. I don't know.
Antidotes.
No.
I thought about antidotes. You know antidotes?
Yeah.
What are antidotes? So what I ask you now? Me, I'm asking you. I thought about antidote for the effect of the Islam known.
Yes.
Continue. You ask, Afifi, ask. It depends. So, see, dosage form. Remember. You said they rotate where? Check it up. Check whether it appears in tablet or. Oh, check it up. Tomorrow you tell us whether it is in tablet. It's simple. Just Google is in tablet or whether it's tablet syrup or inhalation. But the point I want to make is that there are some drugs that cannot be in tablet form. Maybe because of their properties, their chemical and physical properties, they cannot be in tablet. So this what you are saying is not bad, but find out yourself. Tell us in our next class. So I said that the desmopressin is administered what? Intranasally. For treatment of what? Diabetes insipidus. What is diabetes insipidus? Even calcitonin that is used for what? Osteoporosis can also be administered through this way. Now tell me, what business does what you inhale from your nose to treatment of what? Osteoporosis. Do you think it's local? Good. But nasal decongestion, do you think it's for nasal decongestion? Do you think it's local or systemic? Local decongestion. So nasal decongestion. What is nasal decongestion? So is this systemic or local? I agree with you that intranasally can be systemic, but I'm specifically now asking of if your target is to decongest your nose. That's the question I ask. Even those that abuse cocaine, they sniff it, right? Now, how does what you sniff, how does it enter and get to your CNS and start making you to feel high? Is it local? Is it local? Remember, I'm asking this because remember I told you that you can see intranasal in local and what? Systemic. That's why I'm asking these questions. So we appreciate what you are doing. Okay. Let me see if I missed now something. Okay, let's look at another local route. Topical. In topical now, the formulation is applied mainly for local effect of the what? Drug. Mainly for local effect of the what? Drug. You've seen a lot of them. Maybe you hit your leg somewhere, there's no open wound, maybe you have inflammation, you have maybe akpu there or something. You call it akpu, right? In your local language, akpu. And you apply, or generally you feel pain around that area. You can get diclofenac what? Sodium, right? Gel, cream, ointment, as case may be, and apply there, right? To take care of what? So it's local. That place is what? It's local. Even though those of you that have maybe skin infection, true of us, skin infection, you apply locally, right? Yeah. You have maybe those that have they tell you apply maybe this one you call toilet infection, right? You apply the cream, clotrimazole, the cream, right? Yeah. You know clotrimazole, what class of drug it is? Wow. Clotrimazole. What class of drug it is? That's the question. For what now? Which infection? This is what? God bless you. Go far. It's antifungal now. It's antifungal. Don't worry. We'll treat all these things. But please, at this level, please, I want you to study why. Just study. If you are done with your classwork, study. 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 So that the any confidence you have in yourself if you study. It's not just about going through your lecture notes. Study. And if not for anything, establish yourself in this area first. Study. Study. Read extensively. Develop a reading culture. Yes, you've gone through what you did in class. Wonderful. You close it. Go into something else. Study so that there's no matter any area they mention, you have something to contribute. It's very important. It's very important. That's characteristic of someone that reads. Even though you have not done it in class, at least you can say something about it. No matter how little. Not just in the field, anything. It will help you if you study well. If you develop a reading culture, study. It will help you to. You can hold a conversation. There's no topic that they will bring. You will have something to do what? Contribute. There are people that have studied extensively, even though they are in the same class with you. Bring up a topic, even what they will see do in second year. They may not, know it deeply as maybe to go and write exam, but at least they have something to do what? Say, how can you know clotrimazole? You know it, you know it's yeast. You stop at that level. You didn't bother to ask yourself, what is yeast? What are they for? What is it actually? What class does this thing belong to? All right, so let's continue. So, topical this thing is clear, right? Is there anything confusing there? So here now this topical. Listen carefully. Note this point too. Topical does not necessarily mean skin alone. No. Am I communicating? Are we together?
Yeah.
Okay.
Where again do we apply the topic?
Okay, let me ask a question. The one you apply to the one you apply to the mucous membrane of the vagina, what is it called? Is it vaginal route? It's vaginal route, right? So what I said now concerning the clotrimazole in the vagina. So where should it belong to? Not topical. Hello. I want us to be. So what do you think? Should it be vaginal route or should it be on that topical route? Okay. Kina kwenda kwa wani? Kina kwenda yako? I have a question here. Kina kwenda yako? Let's see what it is. Hello. Sorry. Oh, yeah. Talk now. Okay, if it's at the orifice, is that what I'm saying? It becomes what? See, hello, listen carefully. There's something I want to know. In as much as she found it difficult to arrange her thoughts, but she's making sense, so, and she's researching. See, knowledge is not just about your classwork. I'm sorry, let me be sincere. What my issue with her is that she brings it in when I'm saying something else. But most of the things I'm saying here is not is not coming from an empty mind. It's coming from someone that is actually doing something. And you're laughing. You're laughing. Continue. And you're laughing. I made my point that my issue with her is that the way she brings it up is what I don't understand. How she confuses it. No, I want you to understand that what she is doing is not but please don't do this in example, please. Don't bring things that don't concern what you are saying, but what you are doing is okay. You just to know how to arrange it, know when to apply this, when to ask this question. That's my point. Okay? And that's why whenever I am talking about something else, if you're talking, I don't even know where my expression will change. I'll be like, what to do? I asked a question. I said, is vaginal route topical? Okay, what's the question? Can we use it both in what? Oh no! Definitely skin topical. I have a question. I have my reason to ask for asking this question. Skin topical. This means something. It means something. That's why I asked that question. This thing can also be used on the skin, basically, yeah, for treatment of other things. Dermatophytosis, name them. It can be used on the skin. But my question is this: when you say topical, is it only the skin that is topical? Vaginal route is also topical. That's my question. Yeah. And I'll see, and I want us to discuss it.
I want to say no.
Good. What do you say no? Let me know. This girl has gone far. See, there are sometimes she's hello. There are sometimes she's dishing here, and you're laughing. You're laughing. If I ask some people now what is vulva, they may not know. They may not know. They may not know, and they're laughing. She said that she refused to agree that vagina is topical. She mentioned vulva, that unless it's at vulva. Is that what you said? Can someone check for us whether vaginal route is certain as topical route? Topical and vaginal. What do you see?
The general can be considered as involve applying a medication or product directly to the vaginal tissue. In pharmacology, the vaginal was considered classified as a classical remedy. Allows the medication to be absorbed directly into the local tissue rather than being absorbed electrically.
That's what she said now. She said that, well, why do you say no? You say no. But what she did now is opposed to what you say. I wonder why he started no. Okay, you basically say no. Okay. So from what she read now, please, please read that again, please.
The vaginal route can be considered
Topical, good. Can be considered what? Continue.
as it is involved applying a medication or product directly into the vaginal tissue.
Good. It's not going inside the. You know, when you say topical, listen carefully. When you say topical, you are not talking about. You know that you know that involution inside that vagina, we have the mucous membrane. Is there, right? If you move the mucous membrane, you still go down and still meeting all these levels of the skin. The skin here is this one here is keratinized, true of us. But the one in the vaginal wall is mucous membrane. After this keratinized level, you still go down and start meeting all those dermis, and the same thing with that vagina. If you move that mucous membrane, you keep going deep again. Am I communicating? The difference is that the skin here is keratinized. That one is not what? It's not what? Keratinized. Am I communicating? So you place it there for absorption to take place and also for treatment in that area. Am I communicating? So that's why they say that it can be considered what? Topical. So if you have skin topical, you can have also what? Vaginal what? Does it make sense to you now? Does it make sense? It's not, and you apply it there, fine. Depending on what you want to achieve, you can have local effect at that point. You can have local effect at that point. Anyway, now, vaginal route is what? Is it not topical? Does it have anything to do with topical? Now, it's topical. This is can be confusing. That's why I took it this way for understanding. See her face. She's agree, right? You agree, right? You are confused. Do you know why when they talk about route of drug, you don't see the vaginal route? It's hidden under what? Do you know why you don't see skin route? It's hidden under what? That why you see skin topical. Does it make sense? Yeah. Topical on top, not inside. Not inside. Huh?
No, can you say that?
It's on top. See, hello, listen carefully. Are you with me? Yes. Are you with me? Please. Basically, you need to understand the structure of this. The structure of this, the nature of these structures for you to understand what we're talking about. The skin here, this thing you are seeing here, is external. Do you know why we even consider vagina external? It's external. It's not internal. Even in your dosage forms. It's not internal. It's external. It's outside the system. Even though yes, it's a hollow part inside, but this is external. It's still external. It's not internal. Am I committing? It's not internal. It's external. It's topical. But what type of topical it is? That's the point now. You now start the differentiating the topical. That's why I wrote this in first. That's why I wrote this in first. So I don't know.
According to what she said, that this thing, the medication applied in the vagina flows through the body and enter. Can we consider it systemic?
The target, depending on what you want to treat. The target is what? The target is what? Local effects. But just as you have in your skin, what you apply can still penetrate. There's also possibility too there. But the target is what? Local effect. But if you want to treat systemic, if you want to treat an infection systemically, you just got to apply in the vagina and stop. It's not enough. Two of us, you either take the one orally or injection. Two of us. So that's why it's not a strong systemic as I say. Okay. I believe that anytime this thing is brought up, you have something to say. That's why I engaged you. I did what? I engaged you in this discussion. I want to train rational, not people that will just be there. Once the gram from the hand that has finished, nothing else. Once we also, no. You start developing how to think, reason out things. That's why I like how you don't participate in class. She reasons, she thinks, even though if you think, you say it, you will laugh. But she keep thinking. It costs no on you gonna think. I try to Okay, so that flask. All right, so let's. Is it time? I mean, how many minutes break? Really, 1 hour, 30 minutes. As for this one, let's just stop. If you leave it for her, let us just stop. But we will not stop. We are unstoppable. We will not stop. Where's our output? You've changed. Thank God. Okay, so 1 hour, 30 minutes. 30 minutes. Let me see your hands. Hey! Only one person, 30 minutes. 1 hour, let me see your hands up. Give them 2 hours. 2 hours is too long now. 1 hour, let me see your hands. Maximum is 1 hour. Let me see your hands. It's maximum 1 hour, maximum. All right, hello. 10:30 dot, I will be here. 10:30 dot. 10:30 dot. Hello. 10:30 dot. I'm here. We'll continue with pharmaceutical calculations. So in the next class we continue from. Let's see where we continue from. Is it ocular? Okay, in the next class we continue from ocular. Thank you very much for your attention. God bless you.